Consistent with the global effort to eradicate the coronavirus pandemic, the United States Ambassador to Sierra Leone David D. Remier has on Wednesday, September 8, 2021, handed over 151,200 doses of the Johnson & Johnson vaccines to the Minister of Health and Sanitation. According to the U.S. Ambassador, the recent consignment is the third set of Johnson & Johnson vaccines that Sierra Leone has received through the COVAX mechanism.
Agencies, members of the media, respected colleagues and officials, all protocols observed. Good afternoon. First of all, I'd like to congratulate the Ministry and the people of Sierra Leone on the arrival of this shipment of Johnson & Johnson vaccines. This vaccine, which requires only one dose, will greatly assist the country in scaling up and rolling out life-saving protection to even more people, particularly in rural areas. I'd also like to commend the tremendous efforts that the ministry staff, community health workers, mobilizers, and partners are making to get COVID-19 vaccines to as many people as possible, as quickly as possible. This is evident during the recent 10-day surge campaign, which resulted in over 90,000 vaccinated as of last Friday. This vaccine shipment will be the third that Sierra Leone receives through the COVAX mechanism, which was designed to accelerate the development and manufacture of COVID-19 vaccines. Like other partners here today, the United States firmly supports COVAX's goal of rapid, fair, and equitable access to these vaccines for people in all countries, including Sierra Leone. This shipment of Johnson & Johnson vaccines today is part of a larger vaccine sharing agreement that President Biden has committed to, which further strengthens COVAX's mandate. Equitable global access to safe and effective vaccines is essential to end the pandemic. In order to stop the spread of COVID-19 and its variants, we must vaccinate as many people as possible, as quickly as possible. So I'm honored to be here today, standing in partnership with COVAX. I'm proud to work with Sierra Leone towards ending this pandemic. I wish everyone continued safety, and I salute your resiliency during these challenging times.
In his statement, the chairman for NACOVAC, Sheku Bangura, complimented the efforts made so far in the fight against the third wave in the country.
Thursday, for a very huge support to the government of Sierra Leone in the fight against COVID. Where we are in the fight, we don't want to close our economy anymore. We are actually poised to open up. The way we have postured the response is to limit the extent of putting the burden on the fight against COVID on our people. And we have actually structured right from the point of leadership that the architecture that is set by His Excellency ensure that we do all we can in terms of using our knowledge of the evolution of the fight against COVID through data to guide our policy interventions. We have been able to contain the third wave within short period of time by virtue of the advisory that we have received. It is very clear from the evolution of the data that we will be seeing cycle of waves. Economists call it business cycle, I think epidemiologists call it waves of attack of the pandemic itself. What we want to do is to put a stop on that. And we are very clear that we must keep on with all the public health advisory that is given to the population. We continue to face masks, we continue to social distance, we continue to ensure that we follow hygiene advisory. But we are very much sure that the critical and most potent way, as you have already said, H.E., is to ensure that the people take vaccines. We've been very slow to get to the vaccine space as poor countries, but I think with the leadership of the U.S. and other partners, the market failure is being broke through by international coordination led by the U.S. And we are very pleased that on the way many other big institutions were established to break through market failure, COVID is proving, and COVAX is proving to ensure that we do have access as poor country in this space. And the support from the United States government with bringing another tool into our fight through J&J. It's exemplary, timely, and I think we will do all we can as a government to ensure that these vaccines reach the arms of our people, each and every one. We have clear targets for 2021. I think through advisory from the Ministry of Health and the staff, but also the pulse and poise of NACOVAC team and staff, we should be able to ensure that these are deployed in a timely fashion to be able to reach the goal that we have set for 2021. And we know this is just the beginning because we want to be able to reach out to a reasonable number of the population to create the herd immunity required to open the economy.
Giving his keynote address, the Minister of Health and Sanitation, Dr. Austin Derby, thanked partners for supporting them with more vaccines, noting that in ending the coronavirus pandemic, the health sector needs to embark on massive vaccination of people across the country.
Great effort of prioritizing the few vaccines we had to focus on healthcare workers, to focus on frontline workers, to focus on the elderly, and to focus on people who had pre-existing conditions. So we've done a lot of that, but we know that for us to really manage this outbreak, we need to have massive vaccination that's available and accessible to all. So the President, in his wisdom, when we heard that there was going to be a third wave, when the numbers were creeping up, he really engaged COVAX, really engaged the US government directly, as well as other governments, to help us out. In fact, we had a direct call with the COVAX leadership, said Berkeley and others, to just say this is really important. And I know the ambassador has been working tirelessly to make sure that this ask from the Sierra Leone people has been heard in the right places. Today is a culmination of that, to receive over 151,000 doses of the Johnson & Johnson vaccine for us here in Sierra Leone. We want to say thank you very much. The really cool thing about this is that this vaccine is a single shot vaccine, one time. In Creole, they can say one time clutch. This is going to be a real game changer for us because there are people in remote sites, in very difficult circumstances where you don't have the time to go back and forth with them. And so having an opportunity to give them the shot once and be protected is going to be a major, major, major contribution to our managing this epidemic. We're very fortunate because the numbers that we saw in the third wave are beginning to go down, which is really great. But if you look around the world, the numbers are going up. And so we know that even in Sierra Leone, there was a first wave that went up and came down. We brought it down. There was a second wave that came up and we brought it down. There was this third wave that came up and we brought it down. What's going to prevent a fourth wave? What will prevent a fourth wave is that if we are vaccinated and ready for it. Complement of vaccines. You have the Johnson & Johnson vaccine. You have the Sinopharm vaccine. You have the AstraZeneca vaccine. All of these vaccines are safe. All of these vaccines are efficacious. All of these vaccines are free. And we know that people, when they're determined, they will get these vaccines, they will take these vaccines. So the government and our partners, we've done our part to bring the vaccines here. We, the Sierra Leoneans, have to do our part to make sure that these vaccines get into our.
Reporting for Beyond Borders Online Network Television, I am MOHAMED AMARA GANDO.